Hello. This is the Quite Frankly podcast because life is weird and we have thoughts.
Oh, my name is Joanne, and this is my sister Danielle. And Danielle, before we begin, I want you to guess what I had for lunch, and I will give you a hint. It is a classic Frank family lunch.
Peanut butter and jelly.
Yeah. I still love this stuff.
I love it. Do you like the crunchy peanut butter or the smooth peanut butter?
Crunchy all the way.
Me too. My kids don't like it, so I haven't had it in years. Because I really don't eat peanut butter and jelly that often. They do.
Getting lighting in late, sorry.
I'm just saying. So, Joanne.
I want to do something else.
Okay.
Some ASMR, if that's okay.
Okay.
Okay, ready? Yes. Did you hear that?
Yeah, so you're drinking a soda?
Now watch. No, it's sparkling water. Ready?
Okay.
Just for fun. Okay.
Well, we all got to have a little fun in there. So, first off, Joanne and I wanted to really talk about healthcare.
Or my rant.
Well, I feel like maybe it's I might even delete some of it and just let it come into here, because I think that it's important for us to kind of start afresh, because we got into a little bit of a rant, Joanne and I. We both feel very strongly about like where healthcare is in today's world, because it's insane. And Joanne was just saying that if you've been around for a few years, you know the difference. You know the difference. A lot of maybe millennials don't. Definitely not Gen Z. They have no idea. My son, who's 27, was born and I paid a $5 copay. So I think that it's really important for us to have this discussion. But before we do, I just want to thank everybody for subscribing. Joanne and I are trying to get our subscriptions up, so this way we can do some lives, because that would be fun. So be sure to subscribe, share with your friends, comment, do all the things that normal people would never do on YouTube.
You want to see us mess up? You want to see us mess up?
Come on.
It's got to go live. And I can't tell you, Danielle has a sailor's mouth.
Shh. Stop. Gonna get me in trouble.
Yeah.
Okay, so while we were preparing for all of this, and I know Joanne has some very opinions, a very opinionated view when it comes to concierge insurance. I also want to discuss
health
a little
insurance in general.
Health insurance in general. Like, how much is it costing us now? Like, Joanne and I have an agreement when it comes to this podcast, is that we feel very passionate about not getting into politics. And weirdly, I don't understand in many ways how healthcare, our healthcare, the things that keep us healthy, has become such a political hotbed. So I think both of us are going to try our best to just leave that
I will say
at the door.
It's an issue. It is an issue for everyone.
Yes.
No matter what political party you are. I believe that each party has its own way of approaching the issue. But we're going to discuss our experiences after 55 years of me living on this earth, but 30 years of dealing with the health. My kids think you're older. Yeah. I think they think you're more sophisticated, though. I didn't want to give you that compliment right away.
Okay.
But I think they think you're more sophisticated than I am. And I can see it. But anyway.
Okay, we won't even go there. Okay.
There's not much of a difference. But, so we've been around the block a few times. So we saw when it was affordable. And now it is nowhere near. And this is more than just inflation.
So I want to start off this whole thing to kind of give you a snapshot of like early 1990s versus today. Just little things, nothing crazy. Like for healthcare spending, Like it has ballooned. So in 2000, U.S. healthcare expenditures were about 1.4 trillion. That's in 2000. By 2022, that figure tripled to roughly 4.5 trillion. That's not a lot of time.
Yep.
Now, per capita, cost surge. Now, that's basically from about 2,100. This is in the 1990s, like $2,151. Now, that's in 2023 dollars. That was in 1970. So that's around the time Joanne and I were born. To 14,570 per person in 2023. Now, again, that would be in 2023 dollars, like in today's money. In the 70s, we would have had to have paid about 2,000 with inflation adjusted, right? This is what it would be like
Just
for today.
Inflation's like 3% a year,
Right.
I think. But
So in other words, we're showing inflation, like with inflation adjusted and everything like that. It would be like today if I spent $2,000, but really we're paying 14,000. And I mean, we can look at the share of the GDP. I kind of feel like, which is the gross domestic product of the country. It used to be 5% in 1960s. Now it's 17%. I kind of feel like personally part of that is because of the boomers. Like they definitely are going to have to take a lot more health care. But what I think is really stunning is how over the past 2 decades, medical care inflation averaged 3.1% annually compared to 2.6% for all goods. It's gotten so expensive in comparison to just goods. And we all know that for all goods, it's gone up significantly from there. Then on top of that, we're looking at what are the different reasons. If you look up any website that is like sponsored, you know, I'm talking about like one of those public policy types sponsored. They're saying it's because of hospital consolidation, administrative complexities, high cost of technology, that they're the major contributors. I actually think it's that corporate structure. And the fact
Yeah.
that so many of the insurance companies and even our healthcare providers, like hospitals, have become corporatized. Corporatized, is that a word? Or did I just make it up? I'll make it up.
they're for-profit.
Right. So,
But
I mean, when
will
you
say this,
hear
before
that.
you say that, I have heard from doctors who say hospitals are struggling.
Oh, I have no doubt that they're struggling. But
Have you seen those commercials for the middleman? The middleman is taking all the money.
I haven't, but I can
They
imagine.
said there's usually discounts that the medical community gets, but the middleman takes it. Whoop. I don't know how true that is. I haven't looked into it, but I've seen the commercials and I go, who is this middleman?
It's me,
It's me.
Mario.
They
No.
have a name for it. It would be interesting to look into that.
Well,
But-
I feel like even with the wages and medical inflation, I mean, I was just talking to Joanne about the fact that even the percentage, like when you go for a job and it happens to have insurance, right? In 1988, health premiums were 7.9% of that worker's compensation. So, you know, you knew that, let's say if you said, hey, I got insurance, I don't want to take that. I'd rather have the 7.9% more or 8% more in my salary than you paying for that insurance. Now it's 17.7%. I mean, that's
I will say this about insurance.
but that's
my
equating
experience.
to over $8,000, almost $9,000 less
but
in
here's-
annual wages.
Here's the difference that we've experienced with because our insurance, and one of my rants at the last video was that we shouldn't be getting our health insurance from the job that we have. It's our how we are covered is dependent on what job we have and with which company.
Yeah.
So back in the day when you I feel a burp. This is the problem with sparkling water. It had to come. I've done worse.
Okay.
But anyway, your job is dependent on what kind of health care you're going to get. And back in the day when I first started out, and I don't know if you felt this, insurance was not a line item on your paycheck. The company just paid it. And you went and you did a copay of, say, $25. Today, every November, we have to pick which insurance plan we want, how much is going to be taken out of our paycheck because of it. That was a better one. But my point is, healthcare has not just changed in the cost that we have to pay out of pocket, but the way it comes out of our paycheck has changed. It didn't come out of the paycheck before. Now it is. Or at least you never saw it. I think everyone, the company
I think that has
just
to do
paid
with
it.
government policy and being able to take credit for
Is
and
it?
tax. Yeah,
I thought
think
this
it's
was
for
a corporation thing.
No, I think it's partially because of tax credits in your tax return at the end of the year, because tax returns
Wait,
they
for
have
us?
because think about
I
it.
do my taxes. I did not see anything
You're
about.
if you get it through your employer, I don't think you have
Yeah,
to.
you just do a check mark. I get it through my employer. That has nothing to do
Yeah,
with...
but I'm pretty sure they report it. The employer
Yeah.
does. So they
Yeah,
have
but
to
that has
have full
nothing-
transparency.
Right? But that has nothing to do with taking it out of our paycheck now.
Right. No, I was going to say I had to pay part of my premium through my paycheck as well.
Yeah,
I mean,
but
it's
was that the case when you were in your 20s and maybe
No.
early 30s? Yeah,
No.
that was not the case. And that was the norm. I don't think our dad did that. Our dad the company paid for it. And everyone, they paid for the same. Now I think you're put into high risk categories too. I'm not
Yes.
sure. I'm not sure if that's how the companies do it, but I know every November now we have to pick a plan. We have to pick how much we want to pay. They're not great plans either. And if you choose the one where it's low out of pocket, it takes so much out of your paycheck. So we always, hedge our bets and say, okay, let's do out of pocket and don't go to the doctors.
It's very funny because I keep on looking to see if there's I was trying to find something that showed what's the percentage of people that are getting their insurance through employers. I mean, obviously a lot of people are getting it from different ways as well, or just not getting it all.
Yeah, that affordable health care, now you can get it, but that one's dying.
It's not affordable.
because-
It's not affordable. And also
and
with different
a lot
bills
of
that
people
went
don't
through.
take it.
Yeah.
They have a lot of issues, and I think it's because
Unfortunately, after the 2026 elections, that's all going to go to hell in a handbasket, from what I understand.
2026.
Yeah, it's in the new bill. The healthcare costs are going to go up 75%. I think it was.
Oh,
I forgot
yeah,
the exact number,
The
but
big,
yeah.
beautiful bill waited until after
The
midterm
elections, yeah.
elections. Yes. Yeah,
So I think that
was-
the consequences for individuals as a whole, what they're saying is that a lot of people are just either postponing medical treatment or they're just skipping it altogether, just kind of like what you were
That's
saying.
us.
And so it was saying that in 2022, about 38% of Americans postpone medical treatments due to costs. That's the highest level since 2001. And then as of mid 2025, that's of this year, 41% of U.S. adults have debt resulting from medical or dental bills. I actually thought it was a little higher. Postponed care definitely leads to worse outcomes. I mean, in the long run, 18% reported that their health got significantly worse because of it.
Yeah, we're lucky if you don't get sick.
Yeah.
That's you can live a long life if you don't get sick. Let me tell you a story. Because
Yeah.
we've been saying a lot of stats, and I
Yeah.
just want to put a little personal spin on this.
Yeah.
So the way our insurance actually works is they really want to encourage you to get a physical. So they give us money if we go get a physical, which basically pays for the physical. So I went online. Maybe it pays a little bit more, but then they always end up giving you should have this test and that test, and then there goes the bonus. But I went and wanted to go and get a physical. Plus, as I said in the last video, I've been thinking about HRT, hormone replacement therapy. As I was looking for a doctor, there was very few choices. And I was like, what the hell's going on here? But then the healthcare system we've been going to has been pushing concierge service. Now, I have a friend who does concierge, but it's a little bit different than the way she doesn't live quite, she lives a couple 100 miles away, so a couple of hours away. And she said all she has to do is call them and ask for, this is what I need, or this is what's going on. And you can have as many office visits as you want, as many phone calls as you want, if you pay this flat price. And I thought that's pretty awesome. Now, she lives out in the boonies. I live here. She pays under $1,000 per person. Here is $2,500 a person. Now, the site I was looking for a doctor's appointment, and I couldn't find one, was pushing this concierge service. I looked into it, $2,500 per person. So if I'm getting it, that's $2,500. If my husband's getting it, that's $5,000. If it's a family of 4, that's $10,000 a year. Mm-hmm. And that does not include hospital costs. If you end up in the hospitals for anything, that's a totally different cost, or specialists or anything like that. Now, the what also bothers me about it is they said, we'll give you a comprehensive checkup. It's like, then what the fuck are you doing now? Yes, you can bleep that out, sorry. But what are you doing now? Yep, you go in for a checkup, they take your weight, and then they say, how you feeling? And you're like, good. And they say, good, you should have all these tests. And then you say, my neck's been bothering me. And then they say, you should come in for another appointment for that. Mm-hmm. But if they, they want to check my, every time I go in, they want to check my thyroid too, which I should check yearly. But that's a blood test. That's okay, because that costs money. But if they want to check something else on you, that's not a checkup. So what have they been doing all this time if now in the concierge, we'll give you a comprehensive 2.5-hour checkup? I'm very frustrated because I can't find a doctor. I even called a couple of doctors and said, hey, look, I saw your name. Are you taking new patients? No, she's not taking new patients. They're doing concierge. And the few doctors that are left that are not concierge, you can't get in to see.
I don't think it's as prevalent here, I don't think, but I could be wrong. I'm
It's
in
common.
Florida. But what I
It's a
will
common,
say
just wait.
is if when your insurance, like for me and my youngest son, if I did not take the tax deduction, let's say I make more than what the minimum is in order to get a tax deduction, right? I'd be spending on average about $1,200 a month on insurance, knowing that I still had to pay copays. Those copays are normally about $60 a month. Right now, like $125. They changed my insurance on me and didn't tell me. It's the same insurance as I had last year. It went from $60 to $125.
Oh.
Yeah. So ultimately, it's problematic. It's problematic. So like if you put it in that perspective, it comes out to a lot of money. So I can understand where the concierge becomes really appealing, because that does come out to be less money. However,
Per person, though?
ours also pays for partially. That's the thing. I've never had to use it. Knock on wood. Sorry, I had to find some wood. hospital, stuff like that. But like I used it for a biopsy because I'd have been paying insurance. That was when I was actually working for a company and they were paying for it. It was supposedly this
Concierge?
great. No. This is with health insurance. And there was, after they paid for this biopsy of my thyroid, I still had a nugget of $1,200. Why? Doesn't make sense to me.
Oh, you had to pay when you said the nugget. I was like, "What are you talking about, nugget?"
Yeah,
Then
I had
I'm
to pay
picturing
$1,200.
a piece of the thyroid coming out, and I was like, "What?"
No. For that appointment.
Were they checking for thyroid cancer?
Yeah.
Well, why didn't they use the? Because
They did. That's why they decided to do a biopsy to just make sure that it wasn't a problem. Now, when I went to the hospital,
I question the healthcare near you. To be fair,
yeah, when I went in to go and do the biopsy, the doctor that was doing the biopsy said, he was looking at my chart. He's like, "I don't really feel like you need this biopsy.
Yeah,
I think your doctor is
that
being
sounds right.
overly cautious."
Yeah.
And he's like, "But you hear?" He was very nice, but it made me kind of go, "Yeah,
Yeah.
you mean I didn't have to spend $1,200?"
Yeah. Oh, I had a doctor who convinced me I never had a mammogram before, and I said, I guess it's time I should get this. I think I was 45 at the time. And she convinced me to get a 3D mammogram. Never had it. I am not in the high-risk category whatsoever. And she's like, "Oh, you want 3D?" So I went, got it done, and the woman said, oftentimes they'll ask you to come back because they'll see something. This is the baseline, and they'll ask you to come back again. And I'm so glad she did that because it was $300, and that's with the insurance. And somebody told me, no, the Affordable Health Care Act made it so that mammograms are free. I was like, no, it was $300. And it took a while. But then when I found out, because I had the 3D one, which I didn't need it was $300. So I then got a phone call. Oh, well, then they asked me to do a follow-up. And I was like, oh, man, I don't think I can. But I started to. And the guy said, insurance won't cover this. It's going to be $500. Just so you know, I don't want you to be surprised. It was really nice that he said that because I would have been surprised. And I went, no, thank you.
That's the other thing.
5 years later.
I don't understand the
10 years later.
the non-transparency, because I questioned everything all throughout the process, asking.
How often have you asked, how much does this cost? Oh, we don't know.
Mm-hmm.
That's another issue. We don't know. They blame it on the insurance companies.
And then they said the insurance approved it. It's covered. But
Completely?
they don't explain. Yeah. Yeah. It's covered for $10.
Yeah.
I don't know. But I think this is what it comes down to, is that this is why they're saying that so many Americans' disposable income, let's not even talk about, let's get into maybe we should get into the fact that it's not even necessarily disposable anymore. I think a lot of people have spent out their disposable in the way that this economy is. Mm-hmm. And now you have to make hard choices. What are you going to do?
I read in AARP this one woman who had an issue. You know how they complained that, we don't want a system like Europe because they have to wait in line forever. Well, she had an issue. I forgot what the issue was. She went to get a doctor's appointment. It took her 3 months to get it. She went to the doctor's and she goes, no, you have to go to this specialist. We don't deal with this. Mm-hmm. So another 6 months later, she goes to this specialist and they're like, what are they talking about? This isn't our thing. You got to go back to the doctor. And she goes back to the other doctor and it's another 3 months. And she said, I can't keep waiting. It's getting worse and they're not seeing me. So she ends up doing the concierge. And she went to the concierge the next day, had everything done. It was actually something serious, I remember.
Wow.
And it was on the verge of getting to a point where you can't take care of it anymore. And she even says in the article, I don't know how people who don't have the money is able to do this. And that's also an issue with our country now. They complain that we can't have a one-party system, or, have the government pay for it,
Right.
because of the long lines. We have long lines here.
I was going to say, to get an appointment nowadays, anywhere, it's a long time. And
It's
then
months.
even just in my county, like, okay, so at one point, my son had an issue where apparently he had a tumor that was very close to a vascular area. And there was literally no doctor that could help him in our county. None.
You had to
None.
go out, I guess.
We had to go out to Orlando. We had to go out to Orlando Children's Hospital.
That's a very good hospital, by the
Yeah.
way.
No, thank
It's
God.
like one of the best in the country.
Yeah, didn't cover it. It wasn't under my insurance.
Oh,
Because it wasn't in my county.
yeah.
And this
That's
was
not
this
how
was a
it
few
should work
years ago.
either.
This was a few years ago. This was a few
Okay.
years ago. But the bottom line is it was very scary.
Yeah.
And I remember thinking to myself, well, at least I have this house, and if I have to sell it. All right, I don't care.
Isn't
I'll
that
sell
sad
it.
that
I'll
you're
sell it.
thinking that?
And I'll be able to like pay for what, like if it was that bad. I mean, thank God it came out benign. It wasn't as close to, any major blood supply, but there was a moment there they thought that a major blood supply was wrapped around this tumor.
Oh,
It turned
God.
out it wasn't. That was so scary. And to think that my only recourse was like, well, all right, I guess I got to sell my house.
Yeah. Yeah.
If he has to have surgery, I'll do what I got to do.
Yeah.
I'll live on the streets. That's fine.
Yeah, I call, that, not Kickstarter, what's that, it's like a fund me site, GoFundMe. I said, that's become America's healthcare system. Everyone on there is like, I have this medical problem. And it's like, that's our medical care system. We have to raise our own funds so we can pay for medical care. I want to add also to this whole waiting online thing. I had a doctor who, and this was some years ago, and I went for a checkup, and they wanted to do a follow-up, and this was when I first found out I had Hashimoto's, and I made the appointment, and it was close to Thanksgiving, and I said, are you sure I can do it this week? And she said, oh, yeah, because it wasn't Thanksgiving Day, or it was that week, like that Monday to Wednesday. Come Thanksgiving week, they call and say, we're going to have to reschedule. She can't meet.
Mm-hmm.
And I said, okay, can I do it next week? Oh, no, she's booked out for another 6 months. This is their problem. And they wanted me to accommodate their absence. Needless to say, I stopped going to that doctor. She eventually retired. She was a lovely doctor, but getting in to see her was a nightmare. It's like,
So-
you want me to accommodate your mistake?
Yeah. So let me ask you something, because, and again, I'm trying really hard to dance that line of not getting political, but when I look at it as a whole, like, what is the solution to this issue? Like, the part of it is like I said, single payer or whatever, but
Yeah, that's it, single
but
payer.
there's too many people making money on the healthcare system as a public entity. Like healthcare insurance companies, you can't just suddenly go, guess what, guys? You don't exist. That's not going to happen. It's
Because
not
even
going to
the
happen.
Affordable Care Act is still encouraging this capitalist healthcare system.
And the government, and again, and I'm saying this, both sides of the party, like both sides of the aisle, are profiting
yeah.
off of this. They're profiting by
Well,
their investments and their support, the money
yes.
that they're getting for their
I'm not
campaigns
gonna
and everything.
lie. We profited off of healthcare. We put stock in healthcare, and it has done well over the years.
I had a 401k and might have had some
I'm
health care
not-
in there. I don't know.
I'm not happy about it. I mean, I'm not happy with our healthcare system, and if it changed, that's fine. But it's a
here's the
sure
thing.
bet to put your.
Could you maybe put the money someplace else though? Like this is what I'm saying. If it disappeared, people could find other ways to make money. But in the same breath, it's like if it's there, it's just going to continue
Somebody's
to be
gonna
this
buy it.
monster, right? So
No,
I mean,
somebody's gonna buy
obviously,
it.
it's not going to change, right?
Yeah.
It's not going to change. They're not going anywhere. So then it's about like you've got to look at what's the proactive things that us as civilians can do to combat this. And well, one is be as healthy as we possibly can.
That's true.
Like,
Fair enough.
like, well, no. If you really think about it, when we think about Eastern medicine, and a lot of the practices that it's more of
It's not
taking
just
care
Eastern,
of ourselves.
It's old medicine.
Old
it's
medicine.
from old wives' tale. Now, I will say,
Not the kind that's saying put an onion in your sock or something. No, we're talking about more proven
I don't think our
things.
family got COVID because we had onions, lots and lots of onions.
sitting around the house and yeah.
Actually, they actually said there's sulfur in onions that they believe does kill bacteria or something. I'm not.
Oh, yeah,
saying
no, they
use
say-
onions.
they say
I am
that-
joking.
No,
but
they
I
do say
think
that
there is-
onions, leaving one open, it does absorb it. I forgot what it was, but it was
Yeah.
a proven thing. But
It's
the,
probably not enough with the bugs
No,
we have today.
but I think as our overall health, like eating well and all this other stuff, which again is really hard, but it's something to kind of work on and become a little bit more present in. But this is where I'm also getting back to the concierge. Is the concierge like idea kind of like the medical doctor's way of getting out of the system as well?
Yeah,
Because
I
they
thought of that.
suffer from that
Yeah.
insurance. And any medical doctor I've ever spoken to, because I once spoke to this one doctor that was with hormone, and she was so tired of, she goes, what she went into, she was a hormone doctor. She went into this whole thing because she really wanted to make a difference in women's lives. And what she found very quickly is that every single group that she was getting into or any place that she's working, you had a time limit. You had like a 5 minutes per patient. Bam, bam, bam. In order to make the money that you needed to make for the group, for the whatever, you had
Right.
to pound it out, pound it out. And she said, and then she had all these different, you start, she says, I started to see the problem. In order for them to make money, you had, the drug doctors, this, that, like the drug companies and this, that. Like there was just a lot of different things that she was like, let me step back.
Yeah.
And she started to be a practice that only accepted cash. It wasn't a concierge at the time. I spoke to her a few years ago. And then if they had insurance, she always made sure that if there was any blood work that needed to be done or anything like that, she'd find out to make sure that their insurance would cover whatever it is that had to be done. But
I will say this.
she was able to keep it relatively affordable because, one, she didn't have to deal with insurance. So she didn't have to hire people to handle that insurance thing. She's like, I'm not saying we were cheap, but we were a lot more reasonable. And she goes, and I got to spend a half an hour with each patient.
Yeah,
A half an hour
that is
talking
what they
to
say
a
about
patient.
But here's the thing: that's still more expensive than the average Joe Schmo can afford. Unless she has a program like the concierge. Now, I will point out that $2,500 per person. I got to keep saying per person is a lot here. My friend was paying about $1,000, and I think our family in New York, it's like $1,500. So I think my area is exceptionally large. They have too much money here, so they figured they could charge it, I guess. I don't know. But, yeah, maybe it's that. But it's still too much for a family of 4.
I mean, if you're getting insurance through your company, yes. But if you're not getting insurance through your company and you're doing it through the American Care Act,
Yeah.
it's competitive.
They did say, I did read when I was looking into the concierge.
It's competitive,
that-
if not cheaper, significantly cheaper. But you're not getting
Yeah.
hospitalization, so you could get hospitalization insurance that's cheap.
The concierge some of it may be covered under your insurance, not all of it, of course. And I had decided that because I have nothing serious, I do, like I said, have Hashimoto's, but it's not out of control. But what it comes down to is I would do what that woman in AARP did. When you get down to something that's serious, then it's time to call the concierge. I don't think I could use it just for everyday crap. Although Gordon and I talked about just going to try it out before he retires to see if there's any issues, because they keep saying it's a very complete physical. And I know they have those machines that I don't think it's MRI, maybe it is an MRI, and it takes a slice of
The whole
picture.
body.
Yeah, and a body scan, and I think that's part of the concierge service. So, will I ever take it? I'd love to. If I do, I'll come on this show.
I would definitely be curious because something's got to give.
Yeah.
And unfortunately, I think I sometimes feel as though there is a very deliberate plan to destroy things in order for it to either disappear and to completely break down. And I feel like when it comes to the idea that everybody should have health care, that it should be, I'm, to be fully transparent, I am a person that believes that health care should be something that every single American should be able to get.
It should be a right.
It should be a right. It should be something that
Not
we
a
pay
privilege.
taxes for. I think everybody should be able to get access to health care, and no one should be in the position where they could get health care to solve an issue that could otherwise get, like, simple infection. Mm-hmm. But they can't afford it, and they can't afford antibiotics, so they die. Are you going to be willing to let your kid die? Or your parent?
As you say, they shouldn't have to sell their house.
No.
Right.
They shouldn't have to do a GoFundMe. I am always...
Man, we could start on the whole end of life thing with Mom. End of life thing.
When you think that Mom and
they
Dad...
suck you dry.
Mom and Dad did everything right.
Yep.
Paid into the system, made sure they had insurance, tried to take care of save money for their retirement, made sure that Mom was okay even after Dad was passed. They did all the right things. But Mom still was not able to get the kind of quality care. We did the best we could.
I think she got good care.
She got good care, but
we had a family member who had connections. We were lucky.
Yeah. But she was not placed
was
in hospice full time as she should have.
Well, they said they couldn't. We discussed this.
I know, but I'm just saying she died, so I'm thinking that she was should have been on the list of being a person that it should be in hospice because they're dying.
I think that's a tricky one.
I know.
I'm not going to go into that because we're getting into family politics.
I know.
All I can say is I understood it as where she was, it was nice. And when it got to a point where it was really bad, they were afraid moving her would kill her in the move. And she would never make it to hospice. Now, when I heard about the hospice, that's what I heard. You know, like I said, when you have a large family, certain people hear certain things and others hear other things. But that's how I understood it. I didn't think it was a terrible place, although I hated the nurses there.
I think that they weren't equipped.
No.
They weren't equipped for Mom's issues.
Yeah.
That was more for long-term care. It wasn't for someone that was active.
Right, and
Like, I
memory
don't think
care.
it was supposed
Long-term memory care,
It
yeah.
was not
But it was a
necessarily
nice
for someone that was
room.
actively dying.
And, yeah.
Yeah.
Yeah. It was a nice room, and she didn't have a roommate, although they threatened at one point, apparently. But when I heard about the hospice, I thought, that sounds glorious. She would love that. They even had like these doors that opened up and you could push the bed out and she could sit outside. But I don't know. I don't know. I don't know what.
It was
went
my
down
understanding insurance wouldn't cover it.
there. I thought hospice was donation based.
No, not entirely. No. Probably
Now
for some.
I know. I will say this: when they were looking for places to put Mom when it was decided she would go into hospice, they looked at some state facilities because I was discussing this with someone after the fact. It's like, what happens if you're poor? And they send them to a state facility, and the state facilities, I was told, look like prisons. They said it was terrible. There's no windows. It's all gray walls. Everyone just is.
Yeah.
So I think she was in a better place than a state. We were lucky for that. And I have to say, we were talking about, okay, what if Mom lives for a year? How are we going to pay for it? There's a lot of that going on. You can go broke. And I have heard of families selling their houses because they want to give their loved one the best send-off as possible.
Peaceful,
And
a peaceful death.
fair.
A peaceful, like maybe pain-free,
Now-
where they're treated kindly.
Yes. Now, I should also point out, yes, we are a large family. She could have done home hospice, but she could not stand up. And she was a very large woman, which is another reason why I'm on Weight Watchers. Because we couldn't, we talked about getting a nurse in there, a live-in nurse, but she said that I can't lift her. She has to go to the bathroom. I can't lift her. And I saw them pick Mom up in this contraption. She's not like, she was large. To put her into the wheelchair. So home hospice for us was not an option. Because home hospice is supposedly known for being cheaper, affordable, I should say. Yeah, so a lot of issues there.
All I can say, that's
another.
yeah.
I'm sorry,
Like there's
I'm just thinking
no,
our
it's okay because
healthcare
there's this
system
part of me.
across the board sucks.
Yeah, there's a part of me that gets angry about it, and
Wait,
I
I
try
lost
not.
ya.
Oh, you don't hear me?
I don't hear you at all.
Oh. Pause.
Oh, it changed. I think it changed heads. No, it's right. I have the. No, it changed headphones for me.
Oh.
Hold on. I don't know why it switched headphones. I didn't touch anything. But it switched headphones.
Are you back?
I'm back.
Okay.
Or you're back. No, I think you were always there. It was me. But go ahead.
Okay, so admittedly, the situation with Mom does give me pause. It is.
Yeah.
I can't pretend I know or understand the full scope of it, yeah, when you love someone,
Yeah. I think we did pretty well considering the circumstances.
yeah,
I
just-
would have
I
liked
think-
her to go into the hospice, but I will also say, I'm just going to also point out, Mom moved to another state and she didn't change her license. She would have had Medicaid, is it? I always get confused between Medicaid, which is state and which is federal.
I don't know the details on
She
that one.
had the federal one. She didn't have the state one, and the state one would have been really good, but she never got. I kept telling her to change her license, but she didn't.
I just know she was in a lot of pain. Sorry.
Oh, I'm sorry.
She was in a lot of pain, and I felt like she would, like, it might have been different.
I
It might have
didn't
been
see
different.
the pain like
Oh,
you.
I did. I did.
Maybe by the time I got there, had her on enough drugs. I remember her lifting up on her hand. She had the word salad. She couldn't talk.
Yeah.
I was like, I know, Mom, it sucks.
I'm just saying, I just feel like I wish. But I mean, I understand it was circumstances that it is. I don't want anybody to, especially in our family, to feel like everybody did the best they could. But to me, knowing that Mom and Dad, under circumstances for other people, might have been like they had a lot of financial burden with 11 kids. They tried their very best to do the best they could to take care of themselves so that we were not in a position to have to take care of them, and did everything right. And they still did not necessarily get the level of care that I believe they deserved. And that when you think about other people that are not even as fortunate as Mom and Dad were, or not as fortunate even just in knowledge base on how to plan for those things, because that's part of it. Just think about the fact that those people, or anybody that you know, that are not going to have the advantages that Mom did. And
Yeah.
it's devastating to me.
I will say this, Gordon and I ended up getting insurance that will take care of that because we don't want the burden to be on our kids. There is insurance out there. And the nice thing is, if we didn't use that insurance and we just died, like Dad died pretty quick, they get whatever we saved, which is kind of nice. So there is, in that sense, but I will have to say, knock on wood, we're financially pretty secure, and I'm still ranting and raging. Our insurance still sucks, but I'm still ranting and raging because I don't know how people who are not as well off as us. I'm not saying I'm a 1%er. We're not.
Right.
Look at my clothes. Look at my hair. I have nice headphones, but I splurged on that. I am not, we're not wealthy, but.
You know how they have that expression, food insecure?
Yeah.
I'm healthcare insecure.
Yes. Same here. I'm healthcare.
I don't. Well, I
And
mean,
it-
I don't
just see it
have
get
any right
worse.
now. So
Yeah.
it's like it's
Oh.
it's a little it's playing a game, but you know what
Tell
you're gonna
everyone, don't get sick.
do. Don't
Now,
get sick.
Florida used to have for the kids. Is your youngest covered?
Trying to get them covered.
Because I thought when we were there, and
Oh,
this
yeah.
was 30 years ago.
But things have changed.
Yeah. Yeah, we had
And
a
trying
not-
the
going
biggest
into
thing.
politics.
Yeah,
We
but
had a
the biggest thing
different
is
governor.
you also have to remember that like what they do here is they make sure that the like government websites, the systems that they're underfunded and they're underdeveloped. So even just the process of application is horrendous, and you keep on getting looped into here, into there, and like it's like jumping through, not just jumping through hoops, it's jumping through flaming hoops that are a mile in the sky, and you have to dive out of an airplane to get through the hoop
It's astonishing to me
with no parachute.
that we're considered, that they think I can't say we're a first world country anymore. I think we've stepped down. We're maybe a second world country. Not
You know
third
what it is?
world, not
We
quite
have
there.
we have a lot of fun shit like phones, TVs,
I have a phone too. but,
cars.
phones
got-
are another issue. They're a problem.
No, but I'm saying that like we are a country that's rich in consumer
Technology.
goods. Consumer goods.
And that's changing too.
Yeah, well, yeah. And so we're rich in like all these consumer goods. We're buying and buying and buying to fill up a void. But in the meantime, it's like we don't have appropriate health care. We're paying ridiculous
You're
amount in.
convincing me to move. I just watched, just before coming on today, I watched this woman, it's called Raising Wildflowers, is her site on YouTube. And she is considered poverty level in America. And they got rid of everything, even their Wi-Fi. Any Wi-Fi they did, they went to the library. And they saved their money, and they were able to go to Thailand or Vietnam, I forget which. Dirt cheap. Their business is online, and I think YouTube is one of their big money inputs. I think they're still making the same amount of money, but their level of healthcare, or not healthcare, but their healthcare too. Their standard of living is much higher now, and they pay healthcare. Her and her daughter is $52 a month. Mm-hmm. That's dirt cheap.
It's so funny because like the hard part when it comes to the consideration of leaving, right?
Yeah.
I mean, there's multiple. Like one is I
will say this, just real quick. My daughter is in London, and she said there's a huge influx from America across the continent of Europe, that a lot of the countries are now putting stricter rules on coming into the country because there's so many Americans coming.
Yeah, I believe it. We probably should have left a year ago.
It's easier said than done.
Yeah.
Although Gordon always tells me, "Go ahead, Joanne. You can go.
It's
set
like,
up shop."
Where do you get a job? How do you support your family? If you're going, is it your whole
tough.
family? Like I have 3 boys. Like, are they all going to come? Prior to last year, it was also like, am I going to get permission from my ex-husband?
Yeah. A lot of them right.
There was a lot.
Also, they're getting rid of chain migration. Heck, she said in England, in order to stay there now, by marriage, the British citizen has to be making over £40,000 a year. So really, which is a lot more pounds. Is stronger than it's like 50, maybe 50,000. I'm picking it out, but that's 50 US. But the argument is, now you have to be rich in order to marry who you want. It's like,
I mean,
interesting.
If you put it in the perspective of like, that's kind of how it is over here. Any person that wants to immigrate to the United States legally, the amount of money they have to have in the bank is astronomical. But that's a whole nother story.
Where's this? In
it depends
country?
on it in our country. It depends on what country they're coming from.
Mm-hmm, mm-hmm.
But yeah, when I learned that, I was just like, oh my gosh.
Yeah.
Oh my gosh.
Because that's one of the options. We're bringing this up because it's one of the options that even though you have to buy private insurance in another country, like my daughter had to, she went to school there, so she got the insurance through the school, but to stay there for a year, insurance is $1,500 for the year, but all your health care is taken care of.
Right.
All of it. There's no copay. There's no, now, she did have to go to the doctors once and it took a bit, but nothing any different than here. Mm-hmm. I think it was even easier. I think she had some trouble in the beginning because she didn't understand. Like, they'll say, you have to go to the pharmacy. And us, it's like you go to the pharmacy for drugs. But no, going to the pharmacy there, they had medical experience too.
Oh, okay.
It was strange, but I don't entirely get it.
But and if you really look at it, like in many ways, people that do want to leave the country and want to make it affordable, as much as you were talking about the one person that's a YouTube creator and everything like that.
Right.
It is becoming more and more of privileged people people that have the money, people that have the expendable
that's
money
what
to be
her
able to enter a
argument
country.
was.
Yeah.
That was
But
her argument.
her
You
argument-
don't have to be rich.
Don't have to, but it's changing.
Oh, yeah.
It's
Now,
changing.
I asked her on before I came on here, so I didn't see the answer. But I asked, okay, you lived in Vietnam for 6 weeks and now you're in Thailand. I was like, but if you wanted to stay in a place, because her daughter's under 5 right now, she doesn't have to do school. If you're ready for her to go to school, how are you going to get your visa requirements in? So I didn't hear an answer from that, but I was curious.
I'm wondering if she does a lot of she was planning on doing homeschooling.
I wondered that too, but I still argue, in my case, I don't think my kids could have handled moving around as much as that. 6 weeks here, 6 weeks there. Can you imagine moving your kids around so much? I mean, she did say their standard of living is better, but they can't make friends. And
I think
don't know.
it really all depends. I think it really all depends.
When we moved here, yeah, my kids are weak.
No, because like I know with my 2 older kids, it was really hard when we moved to Florida. They had the same friends some of the time that they were in preschool, and here they were, in middle school and high school, and they were like, starting all over. With my youngest, I mean, I always say he's my COVID child. He spent a good year and a half at home anyways. He keeps, for him, it's like, whatever. I'll find them online.
He's a digital native.
We're digital native.
We're digital immigrants because we didn't have it when we were young. He's a digital native.
And it's you could look at it as adaptable. Some people will sit there and say like, oh my God, it's terrible, blah, blah, blah. Whatever. We're just going to look at it as this is how he adapts.
Yeah.
And it is what it is. But I just, being a person that has always wanted, like sometime that she was young, wanted to travel the world. To me, I actually, before I married and everything like that, my dream was to have kids and be nomadic and travel the world and have them experience cultures and living there for a while.
Maybe you should look into it. It's called Raising Wildflowers. You should check out our site.
That was my dream. That's what I wanted for the older ones. And unfortunately, we never got that. But I still sometimes look at my other son and I go, wouldn't it be great? I mean, he's almost done. He's got 3 more years and then he's done with high school. But I think he would be a lot more amiable to it than, believe it or not, the older 2, because he is the kind of person that A, will get online and chat with people, but B, I think he thinks the idea of seeing other things is amazing. He loves natural stuff. Like he wants to go, like say, I know this is not out of the country, but like he wants to go to South Dakota. It was he wants to go and see the mountains. He wants to go to, the Grand Canyon. He wants to go and see a volcano.
South Dakota.
Well, no, I know, but like there's a lot of different places he wants. When he hears about other places,
he wants to explore, basically.
Yeah, like he's not. Yeah. It's usually more national park type things. It's more nature based. Cities like crowds kind of freak him out.
Out of all the, because I hike a lot and I hike at national parks. Out of all the parks, I would say Rocky Mountain National Park is an alpine forest. It was beautiful. You had so much biodiversity I've never seen in any other forest. I recommend it. However, the weekends it's a nightmare there because so many people come in.
Can we do
anyway,
a
I'll
podcast?
Give him tips if he ever goes.
Can we do a podcast episode based on your shenanigans going to different national parks? Because I don't. I've been to some national parks, but like not like you have. And I think that there's something to be said about what a person should prepare for, what they need.
Help.
Like, yeah, they need help. But like, if we have that conversation, I think it would be really nice.
Yeah.
Anywho,
I'm publishing a book about the Grand Canyon. Maybe when that comes out.
Yeah. All right.
I'll do a book tour.
Deal.
On this podcast.
Deal.
This podcast only. You'll have an exclusive talk.
Who knows? Who knows what will come from it? But what I was going to say is,
Subscribe. That's
yes,
what you're going to say?
we're going to
Subscribe.
subscribe.
50 live. 50 to go live.
We want to go live on YouTube. Why? I have no idea. Like, that's going to be, a little bit of a mess, but that's okay. That's okay. Yes.
Just subscribe so we can do it live.
We're trying.
There's my
We're trying our best not to square
coffee
out.
talk.
It's our New York coffee talk. Yeah, that Long Island girl. We take them out of Long Island. You can't take it out of the girl.
You do that really well. I gotta say, when I go back home, I'm always astonished at the accent. I was like, did I talk like that?
Let me tell you, I laugh because like Bob has gotten so used to my accent when I talk about home, or when he hears anybody talk about it, he says stuff like Massapequa, Wantor, Seaford,
Belmore. Belmore. Because I would say New York City doesn't really have an accent, and that they always made fun of. It was always Long Island.
Well,
Or
so
maybe the
forget
boroughs
about
around
it.
Manhattan.
Yeah.
That's Brooklyn. Forget about it.
Yeah, and people forget Brooklyn is a part of Long Island. They love to make
Yeah,
it sound like they're separate,
do.
but they're not. They're a part of
Yep.
Long Island,
They are.
just like Queens. You're a Long Islander.
Queens, huh?
You love to make fun of the Long Islanders. Guess what? You're a Long Islander. Just so you know. You're on the islands.
True story.
True story. You can't deny
I can't do the accents
geographics.
anymore. I used to.
Okay,
I
my
don't think I
friend
was
calls
ever
it
that bad.
code switching. She's like,
Code
oh,
switching.
like why did you lose your New York accent? It's like you're code switching. I'm like, you have no idea why. Like, there's a reason.
It
started many, many years ago when I
had
was an
to-
exchange student, and it was beaten out of me.
Yeah, I was in Florida at the time, and everyone would come on, oh, you're a New Yorker. I was like, yeah, but not New York City. But they would always say, and after a while I went, I'm tired of people saying I'm a New Yorker. So I pronunciated.
There was a study that came out not long ago saying that Long Island accents is one of the top 10 sexiest accents in the world.
Ew.
That's what I said. I was like, that's gross. Ew. But I think it's because it's.
Who did this study?
I don't know. I
Show
don't
me the
know.
facts!
I'll send it to you. I found
I
it and I
don't-
was like, what the? I don't know. And
Yeah.
who would do a study of it? But they did it. They called people, or I don't know what they did, but
Who
they
did
said.
they call? Long Islanders?
However, I have had people tell me that a New York accent, there's something very sexy about it, and I was like,
What is wrong with them?
it's
It's I don't hear an accent with people from Manhattan. I have to clarify Manhattan, but Long Island I do. I hate this hair. It's driving me nuts. I got a haircut a while ago, and I'm waiting for it to grow out. It's driving
people.
me
If you
nuts.
haven't already noticed, this is just now. Joanne and I have given up on the podcast, and we're just talking about life at this point. We're not even. We're just continuing on. We call this the after party. We just forgot to press stop, so I apologize. We're leaving now. Bye. Bye. Where's the stop button? There it is, Joanne. We can keep talking.